Welcome to Weekly Infusion with Dr. Drew Pinsky and Dr. Bruce Heischober. Weekly Infusion addresses medically related topics. It's in the know, entertaining, and everything you want to know about health and medicine. Now, may I present to you the very wonderful Dr. Drew and Dr. Bruce.
Bruce, how are you? Oh, wait, I can't hear you. There you go. Go ahead.
Looking forward to my pathology exam.
Yes, we're going to have an exam today for our dearest friend and very favorite guest, Nicole Angemi. You can follow her on Instagram at Mrs._Angemi. Nicole, welcome back. We can't hear her now.
Uh-oh.
Are you there, Nicole? Oh, I can't hear you.
Oh, dang it. What happened?
Hold on.
Oh.
There you are. There you are. We got you now.
All right.
Welcome.
Cool. Hi.
I'm going to introduce you again. I'm in a great mood because it's time to welcome back our dear friend and very favorite guest, Nicole Angemi. You can follow her on Instagram, Mrs._Angemi, Angemi. Nicole, welcome back.
Hi.
Hey there.
Hey.
And
Word up.
Word. We kind of wanted to start with our exam because we've been in a kind of a, I don't know. I'm irritable right now. And so I'm partly irritable because of the experience we all had in New York last week. I'm taking Nicole around and we're doing a show. We're going to do a show with Nicole.
The pitch.
And we pitched some great executives and they I love them, but I'm not sure they understood what we were pitching, which is always the challenge. And so now we're all we're running around trying to figure out how to help them understand.
Did the content scare them? Were they squeamish?
It's always a little more weird than that. But here's another weird thing I learned about Nicole. Nicole, or Michelle, our crack producer across from me here on the other side of the camera, for those of you watching on Facebook. I called Nicole Michelle like 10 times during these pitches. And she goes, oh, yes, everyone always calls me Michelle. And I thought,
My entire life.
Isn't that weird?
Whoa.
Since I've been a little kid.
It's so weird. And there is something about her that is a Michelle. I don't know where that, why it was in my head. I thought it was because of you.
It's the extreme intelligence and the
yes,
beauty
yes,
and the
yes, all
fantastic
that.
personality.
Yes,
Brashness.
all that goes into my, yes.
I would take that name totally because I love the Beatles song. So.
That's what I'm named after.
Oh my God, that song is so good.
Did you hear that, Nicole? And Michelle Poe was named after that song.
Really?
Yes.
Michelle, you never
It
told
came
me
out
that.
the year I was born, which was 1988.
88. I think there's more helter-skelter than Michelle here.
Wait,
All right.
I have to tell you guys something really awesome that just happened to me.
Please.
So I was at Wawa, my favorite store in the world. You West Coasters don't know about it, but it's a store that accompanies a gas station here on the East Coast that everyone loves.
Great.
And they had a sign up that says, as of November 1st, they're not selling cigarette or tobacco products to people that are under 21 years of age.
That's good.
Great.
Isn't that awesome?
That is awesome. Yeah.
So that's like a step forward in the fight against that for us, I feel.
Nicotine addiction. Absolutely, 100%. And the other, Nicole, when she came out here and visited us in Los Angeles, she reacted very powerfully to our homeless situation.
Really?
Oh my God, I'd never seen anything like that.
Yeah, she was
honestly.
disgusted. I was like, Jesus, you're right. It is disgusting. We shouldn't allow this. But the fact that we allow it is disgusting.
You been to Manhattan lately?
No, well, Manhattan's getting kind of overrun a little bit too. But Los Angeles, we allow people to live in squalor, ill, that we should not. Right, Nicole?
Yeah, and I mean, who wouldn't want to live there? It's kind of beautiful and amazing weather. So I kind of might set up a tent there and hang out there a couple months a year too.
Have pictures like the ones we just were sent. And we were just sent a pathology specimen.
Warn everybody, though.
Yeah, we're warning. What are we warning them about? That they
What's
might.
coming? Just so
Okay, what's
they're
coming is some pathology specimens that Nicole has dreamt up to try to stump me and Bruce. And she's going to tell us the circumstances, sort of, give us some hints about around which this. Wow, this is interesting. Okay, give us a little bit about this, Nicole.
Which one's this?
There's a purple one.
It's the one with the two specimens that looks like pickled beets.
Oh, okay, that one. Okay, so that is. What do I want to tell you about that?
Ectopic pregnancy.
I don't think so. If it's not, it would be an ectopic.
You're kind of. Who said that, Bruce?
Well, then it's an.
You're kind of in the right.
Then it's a dermoid. Then it's an ectopic dermoid or something.
Okay.
Bruce is warm.
Okay, keep going. Tell us the circumstance, or can you, without giving it away?
It's from the right gender and from the right
Zone.
zone.
It really looks
This
like.
is a really you guys are gonna like this. This is a really cool specimen.
Ovarian tumor or something?
Yeah, it looks like an ovarian, but why would you have it bilaterally, right? These are two different. These are two different.
Exactly.
Yeah.
There you go. You're getting warm. It's bilateral.
Kidneys.
No, these are ovaries. These are ovaries because they can see the fallopian tubes and their arterial
Yeah,
supply.
I'm done. I got the general location.
But
Go for it, Drew.
wait, hold on. It literally looks like there is a cerebral tissue in the ovary, which is why I was
Oh,
saying
that's good, Drew. That's good.
why I was saying dermoid, and that's why you said maybe
Teratoma.
teratoma. Yeah, but she said no to that. She said the right zone and all. What else? What else grows like a dermoid that's not a dermoid or a teratoma? That is, anything, Bruce? Is there like an ectopic? Just an bilateral ectopics? That just
You guys are getting so good.
I go for half
I
credit.
might
I'm done.
hire you in the lab if
all right. What do you got, Nicole? Fill it out for
Okay.
us.
So these are actually totally normal ovaries and fallopian tubes.
Mm.
So why would they take out totally normal ovaries and fallopian tubes out of a woman?
Normal.
They're totally normal. And the reason that I said it was really good that you said it looked like they almost looked like brains is because we actually describe a normal looking ovary as cerebriform. That's how we describe it because it kind of looks like a tiny brain.
It does look like a tiny brain.
So they have some genetic disorder where you did it preventively?
Yep.
They're BRCA. These are BRCA ovaries.
Yes.
Oh.
Good.
Did she have both of them? BRCA 1 and 2?
So I'm not really sure on this particular case what it was, but basically what happens is if a woman has either their mom or somebody has breast cancer and they get tested for the BRCA gene and they're BRCA positive, they just do what's called a prophylactic salpingo-oophorectomy, which is just a fancy word for taking out your tubes and ovaries.
Yeah.
So you just don't get ovarian cancer. Actually, Angelina Jolie had this surgery done.
And she had the breasts also. Which
Yeah, the breast also. So sometimes we get both or just one or the other, but that would be a case in surgical pathology where you would get a totally normal ovaries and fallopian tubes from a lady. And in pathology, we actually submit the entire tissue to look under the microscope for just like microscopic foci of cancer.
Sneaky Nicole.
Yeah, you like that, don't you?
Mm.
You guys did really good.
Well, she likes the way we describe before we conclude.
I was thinking
That's what you do in pathology.
I thought it was a
You do
brain at
everything.
first. I thought
I
it was
did
a
too.
subdural.
Looks cerebroid. But this is a good opportunity to talk about getting genetic testing because
Right.
we talked to the guys at color.com. Yeah. Nicole, there's a spit test you can do for $250 at a place called color.com. We're not involved with them, but I did their testing, and I have what's called a Lynch syndrome, MSH6. So I have a DNA repair mechanism problem that's similar to BRCA, milder, but it's associated with GI tumors. So now I have to get more screening done every year.
Yeah, it's also associated with endometrial cancers, I believe. I mean,
It
not that
is. That is
absolutely.
absolutely true, and a little bit
Yeah.
of brain, and a little bit of pancreas also.
Did you have
Yeah.
Did you have a patient you dissected with Lynch?
Yeah, I've definitely been familiar with it. I've seen it.
Wow.
Yeah,
Yeah,
and
totally.
it wasn't part of the curriculum. Yeah,
no,
when
it
we
was
were
not.
training. Yeah,
No.
and so I take middle-aged people now and I test them. And by the way, if you're positive for one of the 30 common genetic mechanisms they test for, they will test all your first-degree relatives for $50.
And great genetic counseling. That's the
And you
better
meet
parts.
with a
This
geneticist
is
for
the
now.
importance of us. I don't know if you're aware of this, and I mean, I'm sure you are, Bruce, because you're practicing and stuff all the time. But we go to this tumor board conference every week in pathology. They have it,
Yep.
and even more specific in educational institutions and everywhere. Usually, sometimes they have like breast conference and they have
Right.
lung conference, and that's all they're talking about is just the genetic testing. I mean, it's how they're treating tumors. 100%
Right. It's
nowadays.
so now to get more specific, it's genomic medicine,
Yeah.
personalized medicine. So there's certain genes that the tumors will elaborate and can change. I'm starting to think about cancer the way I think about infectious disease. You know how bacteria changed in response to the antibiotics. Similar mechanisms are afoot in cancers in terms of response to the various kinds of treatment modalities. And we're not just using poisons anymore. We're using immune modulating agents, things like that.
No, our guest, when we talked about melanoma,
Yep.
that was fascinating, just the genomic approach. And
All right, what's next? Here comes. Michelle's going to send us the next stumper that's going to make us feel dumb.
Can I tell him what I guessed this was?
Yeah.
I
And then when I told you what it really was, you probably
I,
gagged.
no, I no, because I called it. Did you get? Are you looking at the picture?
No, I didn't get it yet.
Oh,
I didn't get it.
okay. It's coming.
Did you send it? It must be a
Yes.
very elaborate one that it's having trouble
No, but
getting through
my,
space.
Well, when you see it, I'll tell you what I guessed.
I think it was censored by the internet.
It might have been.
Oh, no way. Oh, is that it up there?
Yeah, I called it roasted s'more skin.
S'more skin? Not Smurf skin, but s'more skin?
S'more, like for s'mores.
I haven't gotten it yet. Oh, here it comes. Here it comes. There we go. Okay. I got it. All right. Oh, my goodness.
And then Susan wanted to add some chocolate and graham crackers to it.
Yeah, that was me too.
I didn't get it yet.
She's much classier than I am. I'm the one that said, "Does anybody have chocolate and graham
Nicole,
crackers?"
help me a little bit with the stick that's in it. There's some sort of, what is
That's
that?
just a probe we use. It's one of our tools that we use in pathology.
And the purple is just some sort of sheet or something there, right? I don't want to miss anything. And then the probe is what you use to dig into this thing to excise it?
No, it's just like one of our tools that we would stick in something that is like a duct or something that's kind of,
Yes, that's what it
you know,
looks
like
like.
if we were if we had a pancreas, we would stick a probe in the pancreatic duct, or we would use it to probe, you know, just to probe into like any kind of a hole that we want to see as patent or something like that.
There's a
The tool we use.
there's a quality of this that looks like panis or something
Somebody
like
says
that.
that's a glove.
No, it's not a glove.
Oh, next to the
purple.
thing.
Well, yeah,
Oh,
that's
so
like
what's the
me
purple?
actually, you know, that's me like just
That's your
for
finger?
size.
That's your finger, Nicole?
Yeah,
That's
I
your
mean
finger.
the photo. Yeah, for size purposes, the probe is
Oh.
a small tool. It's like
like
the
a
size of a
wig.
pen,
Okay, so
like
I'm-
lengthwise, and then the actual size of the probe is, you know, like the tip
Yeah.
of a pen.
Can
It's
you
just
can
a
you
small.
give us any more symptoms or
You
anything?
guys
or-
should be listening to the pun I made, and it will.
No, I don't want to get. I don't want those kinds of. I don't want.
I'm assuming it's an organ.
My friend said, Julie said kebab.
Yeah.
But Nicole, can you tell us
It's
anything
not.
about symptoms?
I mean, it's not an organ in the sense of. I know that there's some people that call every little stupid thing an organ, but it's
Yeah.
not an organ.
Okay.
Can you
But
give
it's
us
essential for some of you.
any symptoms that the patient had or
Men.
anything?
Pain, uncomfortable.
And this is a dead person. Is it a dead
No,
person? or
this
living
is a
person?
surgical pathology.
Surgical
specimen.
path.
Something from your stomach.
Oh, is this off the
stone.
scrotum?
Oh.
Is this off a scrotum?
You're in the area.
Oh, Lord.
It's not scrotum.
Is it a stone?
Fibroid?
Stone. Okay. I don't
Somebody
know.
asked fibroid.
No.
Pain where, Julie? That's giving too much
What
information.
is that? It looks like a. Is it sebaceous? Whatever it is.
No.
No. All right. I give up.
I give up.
What is it?
It's an adult circumcision.
Oh.
That's why I called it s'more skin.
Or
skin.
phimosis.
Oh, for phimosis.
For s'more.
So
Yeah.
that's the most common reason that they do. What's the white part?
It's just scarred.
Oh,
I mean, when
my
we have
goodness.
it on it, when we have it on African American skin, and it just from the chronic scarring over the years, it
Wow.
just turns the skin like different color.
Tell me
Oh
the
my
crazy,
goodness.
the paraphimosis, because those are the crazy ones. They come when the
come out the
skin
side?
slides down and it can't go back up, so
Yeah.
it constricts the end
Yeah.
of the penis.
Yeah,
I mean,
yeah.
those are crazy.
Yeah, but that's why they do the
well,
resection.
phimosis is not an emergency. Paraphimosis is. So and sometimes you get ischemic tissue, right? Or you don't see it. Haven't seen any of those.
We get ischemic tissue for like Fournier's gangrene from that area, but I've never really seen. No, I've never really seen it.
Paraphimosis, where the foreskin goes down and won't go back up.
But
And-
that's
Yeah.
that's sort of the reason they have the circumcisions is they're having things
Right, but
like
I mean-
that happen.
right.
So.
But those are the ones in the ER.
Yes.
We don't you know. In fact, with kids, 90% of the time with a phimosis, they'll respond to like a steroid cream and over a period of a few weeks to months.
They'll stretch out.
Yep.
Want to just
So you never want to tell a kid in the ER that it's a phimosis. Tell the parents it's going to need a circumcision. That's sort of
you tell the
a
parents
faux pas.
that?
You don't. Never tell them.
What do you tell them?
You just tell them try the steroid
And then when they come
cream
back
and,
as an
and a
adult?
little stretching. No. When they're little kids, it usually responds 90% of the time.
But when they come back as an adult with
Oh,
more
adults
phimosis,
are different.
Yeah.
No. Yeah. That's a whole other thing, a sensitive issue. Recommending. Yeah.
If you don't want phimosis, you have a circumcision.
Right, but
If-
don't recommend. It's sort of politically incorrect these days. Don't tell people they need to be circumcised.
No,
Parents
they don't
with
need to
little
do
kids.
anything.
Right.
They don't need to do anything. They
Yeah.
can if they'd like to, if they want to get rid of this problem.
Right.
There's a way to get rid of it permanently. They
Right.
don't have to. And doing other stuff may get rid of it permanently too.
But that's pretty. Yeah, that's pretty. So
What?
the white
You're
part.
gonna make
That's
me
what
The
I
thing
was.
that bothers me with these adult circumcision specimens that we get is that it's a very, very large piece of tissue. So I think about when little babies get circumcised, it's when what I'm trying to say is,
If you're gonna do it young.
are you missing that as an adult when you're an adult that's circumcised like normally as a child and you grow up? It's like a
Well, there's a
huge-
whole movement to have men regrow the foreskin. Have you seen those things on the? No,
It
seriously.
comes
No,
every
I
10
seriously,
years.
like,
Yeah,
I was
every 10
telling my
years.
husband if we had a boy, I didn't want him to get circumcised, and all my friends were like, "Why?" Blah blah blah, and I was like, "Because it's a big chunk of tissue."
Oh, not at
Like,
that age. Not at that age.
No.
The
No, I know at that age, but I'm saying like, if it were to grow, like it's a junk that is missing as you're older.
A junk
You
that's
know,
missing.
Do you understand
Nicole,
what I'm trying to say?
Nicole, for the record, I'm not missing it.
Yeah.
I don't miss it.
I'm not
And it's not
missing
because
it either.
it's not because I don't have it or never knew about it. I really the possibility of phimosis, I like that that's off the table. Thank you. Good
Me
night.
too.
You know what I'm saying?
Don't
No,
need
you're not listening. You don't.
Okay, wait.
Maybe I'm not explaining myself.
Try again. I'm all ears. But I don't have fire trucks on my ears like you do.
This is awesome.
Michelle, are all the exam questions?
Look, I can't even put it this way over my head
Michelle.
because it's really.
It would ruin the bouffant.
It would totally ruin my.
Nicole,
booty.
are all the questions coming from genitals this week, or are we going to get them?
No, the next one's not.
Oh, good.
You want to give us a little detail on the next one? Because
Oh.
it just looks like a. Oh.
The next one is a dead person.
And can you give us any clinical anything?
This is okay. So
Was it a traumatic death?
That's a rat trap
Yes.
in the Pinsky
Traumatic death.
it's a
household.
traumatic
Okay,
death.
hold on.
and
What-
There's only,
was it
there's
a-
only one way. There's only one way to really cause this trauma.
And was this a head and neck trauma?
Holy shit.
Yes.
Head and neck trauma.
Good eye.
I am looking at a jaw or something, or a larynx. I mean, or a hyoid bone maybe, or something.
Oh man, you're good.
Hyoid?
Yeah.
Oh,
Oh.
that's horrible. There's only one way to get it. Did you take this out? Why'd you take-
Strangulation.
No. Well,
Yeah, you're right, Bruce.
it's strangulation.
Yeah, you know that's the only way to really break. I mean, there's other ways to break it really kind
Yeah.
of if you really tried,
Yeah.
but that's working in the ER, you don't commonly come across that as a broken bone, right?
No.
It's the only bone. It's the only bone in the body that's not articulated.
Very right.
Has no. Has
Well,
What does that mean?
no, that's
no
not
joints.
true.
What else?
What about the patella?
It articulates though. I mean, it articulates with a joint.
It's in a joint.
It's part of a joint. The hyoid really is not part of any joint. It floats free on the muscle.
Yeah, it does.
Yeah.
And it's just kind of it's like really impossible to break unless you strangle somebody.
So we have to explain to people what the hyoid is. They're not getting it. Nicole,
Yeah,
try.
what is that? Somebody said, Michelle.
It's a hyoid bone.
Oh, hi, Michelle.
It's in your neck. But go ahead, Nicole.
So it's in your neck and it's kind of, can you see me?
Yes.
Kind of like in here.
And everybody knows the
Below your chin.
tracheal cartilage.
It's just
That big
so
bony
it's in
thing.
this like weird spot that you can't really break it. It's nestled deep in here within muscles. So it's not like, when Bruce works in the emergency room and people come in with broken bones of all sorts all the time. And it's not one that people could just come in and say, I fell down the steps and I broke my hyoid. Like it just like doesn't happen. So if someone came in, if you do an autopsy and you find a broken hyoid bone, it's like it's also associated with other things that you would see, like hemorrhage in the strap muscles and stuff like that. But you would be thinking like heavily that the person was strangled.
So when she says hemorrhage in the strap muscle, she means hemorrhage. It's like somebody
Like
really
in these
squeezed so
muscles,
hard here.
Yeah, you would look for like a lot of different clues as well.
Petechiae and above and the face, eyes.
Yeah, in the eyes and things like that.
So Karen asked the same question I did.
What's that?
What does it mean that it isn't articulated?
Oh, it's not part. It's the only bone in the body that doesn't have a joint associated with it. Like, see, everything's got a joint somewhere. Hyoid's just floating free in these muscles here in the neck.
Yeah, everybody can feel their thyroid cartilage, right? That big bony
like
thing
your
in the front, and
jaw
it's
is here,
above. It's right above
and all
that.
this is not bone, and it's just kind of hanging out here.
Yeah.
It's not really associated with a group of bones, if that makes sense.
So, Michelle, are there more?
What is the purpose of it? Somebody asked.
Evolutionarily, it had. I remember once hearing about it. Has no purpose in the human really, except maybe to protect some of these structures in the neck a little bit. I think it is articulated in like birds or something.
I don't know.
Right? Somebody look it up. Michelle's looking it up.
Because they
no
use their
clue
beaks and tweet?
Yeah, it's something. It's part of evolutionary. It's like our appendix. It's part of evolutionary heritage. It doesn't really do much right now.
No, but so you have your thyroid, and above the connective tissue attaches to it above the thyroid cartilage. So I don't know purpose. It's part of the fortification, the structure in the anterior neck. So.
You'd argue that's why it stayed around. But what was it originally? Go ahead, Michelle.
It says the hyoid bone provides attachment to the muscles.
No, what was the original? What was its original evolutionary heritage? Yeah.
Give me another two.
Yeah. It had some other. It had some other purpose in lower mammals or birds or something.
God put it there for a reason, Drew.
Shannon asks, in autopsy, how is it harvested?
Ooh, that's interesting, Nicole.
What do you mean harvest?
How do you get it out?
We don't take it out unless we don't check it or take it out unless there's a suspicion that the person was strangled or there was,
But it is a weird thing to cut out. How do you get at it?
You could get it out. I mean, I've taken it out on people just to show my students and stuff. So so when we do an autopsy, we do like a V incision right here because we want to keep this all open in case the person wants to have a viewing. We do that on everybody. Just even if they tell us the person's getting cremated, we still do that just because.
Just in case.
Last minute, people change their mind and stuff.
Yeah.
So we do a V. We do a Y incision, but it's kind of a V from where you're seeing me right here.
Mm-hmm.
We basically lift this entire flap of skin up and dissect this all up. To basically, I do it like all the way up into here, underneath of the skin. And then you could kind of grab it when you're underneath of there. Because once all of the skin is up, you could see all of the muscles here. And then you can grab it when you're underneath of there. But in a normal autopsy, it's not a bone that we would analyze just cause. We don't like harvest it on every autopsy. That would just be something that would be done in a forensic autopsy if they were suspicious of strangulation. If they saw like hemorrhage on the neck, and then they would be like, oh, let me see. And then they would dissect up the neck and they would look at the strap muscles and then they would see hemorrhage there. And then that's when they would analyze the hyoid to see if it was broken. But we wouldn't even look at it in a normal autopsy.
And Nicole, it is the holiday season, so at your house, do you do the turkey instead of somebody else, or do you the one with the electric knife? I'm just curious.
I don't cook. What do you think? Maria's cooking.
I see. Maybe you'd carve. It's what I'm saying. You don't have to cook the turkey.
No, but I always we always get the wishbone. I have some collection of wishbones,
which is kind of like I always think of the hyoid when I see wishbones.
So somebody wants to know how you work with your cool nails, which she has the most amazing
nails.
Everybody asked me that.
I wanted that too, actually.
I've had them since I've been like 17 years old. They're like a part of me. I could dissect really easily with them. I mean, it's just
poke around.
They don't get in the way.
They're like extra tools.
Now, also on Instagram, you recently you showed what I thought was a terribly appropriate and really interesting resuscitation effort. Sorry. And
What?
Now let me ask, where did that come from? Where did that particular video come from?
Someone from another country sent me that photo or that video.
And so there was no There was no liability attached to that, no issues, or were there concerns about the ethics of putting that up? Did you have any concerns about that?
No, I don't. I mean, it was a video taken by a doctor in another country. I don't know where he got it from, but he sent it to me and told me, I asked him if I was allowed to post it, and he said yes. So.
And so you posted it, and I thought it was your description of what was going on there was very appropriate, and it was illustrative of something. Bruce, you might do this in the ER, right?
Used to.
Yeah, I used to do this kind of stuff. It's not that big a deal. I mean, it's just you.
When you say used to, is it because that's a technique that is not performed commonly in the United States?
Well, I'd say
that's something you just don't practice.
We used to do it for blunt trauma. And now that's,
it doesn't change the outcome very much.
Right.
That's why they don't do it anymore.
And also, I'm not at a trauma center anymore. So.
Oh, okay.
Yeah.
I'm just curious.
And I'm old.
No, I was just curious because I obviously I don't work in that field, so I don't.
I've seen trauma surgeons do everything. I mean, they'll do everything sometimes, and I'm amazed that sometimes they keep people around. It's amazing to me. It's some particularly chest crush injuries and things like that.
Right, cross clamp the aorta, but I mean, it used to be done for every blunt trauma. Anybody come in full arrest in a trauma center. Now,
so you're saying blunt trauma? Like, give me some examples of blunt trauma.
Non-penetrating, so stab wound to gunshots, penetrating but blunt. You get, in a car accident. Just
okay, because this particular patient was shot in the chest.
Right. So then, that's when you hear the heroics with putting a finger in the hole or just suturing quickly the hole in the heart and people surviving. But if you can do direct cardiac compression, repair the problem real quickly. But with blunt injury, the resuscitation rate's like 0.
So hold on.
So is that even a thing that you can suture a hole, a gunshot wound in the hole, and a person can actually survive?
Oh yeah.
Really?
Pretty unusual, but it's possible.
Yeah.
I mean,
okay, because I did see. It seems as if that video came on the tail. A lot of people were pissed off that it was being recorded.
Yeah.
And I don't have time to kind of describe what's going on in every single post, but it seems as if that was the resuscitation was happening on the tail end of that guy dying.
Yes.
If you notice, the nurse kind of pulled the bag away at the end, and it seems as if they were just kind of playing with the heart at the end just to show what they were doing. Like it was already dead. Probably
it was like a teaching thing.
Yeah, exactly.
I mean, you warn people before they go to your site. First of all, secondly, it's not a HIPAA violation unless the person's identity is known.
Well, his face was. I think people were upset at the face. You kind of make out, but I loved Nicole's response, which was.
Stop looking at his face and look at his heart, which you're supposed to look at, and maybe you'll learn something. Stop starting trouble.
Yeah, I just
It
stop
wasn't
looking
even
for
his
trouble
face.
and learn something.
It was like a glimpse of half of his profile.
Yeah, for a second.
My page has nothing to do with trying to show who anybody is. It's not. It's about learning. It's not about. Just stop starting trouble on my page.
And that's my favorite response. Just stop looking for trouble. Start
get
learning.
Off. Nobody cares about your whining, and this is what's wrong with 2017. Just shut up and get out of here. I can't deal with it.
I got mad last week. If you recall, I got mad recently.
It was actually today.
Yeah.
Oh yes. Yeah.
So somebody wants to know if there was. She said blood wasn't refilling the heart, correct? In the video or whatever.
It was hard. Yeah, he had no blood pressure. It was hard to get the return probably. But
there were 2 sets of gloves, so they were teaching.
Yeah, probably.
Yeah, he was. His heart was trickling. I mean, like I said, the nurse wasn't bagging him anymore, so they had called it already. Otherwise, she wasn't giving him any air in his lungs. So
right, they'd called the code that he was no longer attempting to resuscitate him. They weren't ventilating him anymore.
And you could see the hole in his heart. It just. You know what I mean?
Yes.
And everybody's just trying to. It's just like people just want to start trouble just to start trouble over things.
And
you
Bruce,
know what I mean?
Yeah, well, listen, I know what you mean. Believe me, I know what you mean. And I don't want to be in the same category with the troublemaker because it makes me offended when people accuse me of things that I'm an ally. And why does forget it? But back to the blunt trauma versus say penetrating trauma. Did you say it again? Blunt trauma, you do not use cardiac massage?
No, cracking the chest. I mean, if somebody comes in, they've been in a blunt trauma, and they're
you
in
do
full
not
arrest.
crack the chest, or you?
No,
do?
I'm not. I mean, I'm not doing
one.
But in
would
general, you don't. crack the chest the way we used to for every full arrest.
Right.
That would
It's
come in. It
just-
was traumatic.
it's
Traumatic, blunt. It's not.
Now you do it for what? Penetrating. Yeah.
Yeah.
And what do you do with an aortic transection, which happens with blunt
Cross clamp the aorta.
trauma
above.
sometimes? How do you get in there without cracking the chest?
Well, no. I mean, if again, the survival rate, if it's up at the aortic arch,
which is
then
where the
it's-
ductus arteriosus is where it
connected.
pulls.
So that's So those are not. I don't think that's a survivable.
Really? I thought they tried to save those. That could. I listen.
Maybe
You know what we're talking about, Nicole?
Yeah, I don't even want to think about that shit. I can't even think. I can't think about
This
like
is Nicole Angemi
saving-
saying it. She doesn't want to think about it. Everybody, now relax.
No, like saving a person's life. Like I don't care if you give them to me dead already. That's fine, but I can't even imagine trying to save a person's life like that. It's like my husband talking about pulling people out of cars when they're in a car accident or they just pulled a dude out of a fire last night. Like I can't even think about it.
Yeah,
I think that's the most traumatic. When you're
Oh
a
my
first
God.
a first responder seeing that, you're seeing it in the context of everyday life. When I
Yeah.
see somebody come in, they're on a gurney. It's a controlled environment, and
you can think about just the
Well-
focus on the problem.
have
the
you stopped at a
pathology.
car accident?
It drives me crazy.
It's very
I can't.
unnerving
I'm,
for me.
I'm useless for the
Yeah.
most part. I mean, I can try, but I'm not. Your guys like your husband, Nicole, know what to do.
Right.
That's what they
He
do.
loves that shit. Like he does. He'll tell me like he would show up at a car accident and like somebody's leg is like stuck under there and it clearly needs to be amputated and they're like, "Get me the fuck out of here!"
Oh.
And they're like, and he's just like, he loves it. And I'm like, oh my God, I would be shaking and I would faint and I'd be crying and I would be like, oh my God, I love you. I'm sorry. Like, I'm not gonna hurt you. And I would fall apart. I would be so nervous. And he's just like, I mean, that's why certain people are just meant to do certain things, you know?
Yes, that is true.
I would fall apart every day.
And speaking of amputees, you posted something today. I think was it an arm injury?
Oh
though?
yeah, the arm. That's yeah.
Talk about
The
that.
driving out the window that with your arm out the window.
Did you see this one?
No.
That's so gnarly.
It made me think about. I'm not an orthopedist, and it's been a long time since I've done much orthopedics, but how they decide when amputations you just got to go.
And if you're lucky enough to be there where there's a very experienced hand surgeon, but the guys that used to roll their dune bugs out in the desert holding on to the metal and the spaghetti looking hands that would come in, that it's an art that I was always so astounded by.
And I'm astounded they could put it all back together, but I'm even more astounded that they know when they can try and when they can't. That to me is the hard part, because it all looks like unmanageable, you know.
Well, they have the microsurgery.
And I remember, here it is. I'm going to show it to you. And I remember when I used to deal with, again, ortho, some of the leg stuff that I was seeing is they would try to preserve it as long as there was a blood supply.
Ooh.
And they would preserve awful stuff.
He received an arm. What?
Well,
Oh,
amputation,
Okay,
yeah.
I was going to say, wow.
yeah. So I showed him your picture, Nicole.
Yeah, I'm really, really familiar with with leg amputations just because they're so much more common than arm amputations.
Why is that, I wonder?
And it's just
'cause yeah.
peripheral vascular disease
Yes, okay. Right.
is just worse in it just is in the legs. I'm just
Yeah, if it's because of further
assuming
distance.
because it's further from
Yeah.
the heart.
Yeah,
you know,
that's right.
And just so many, and you just see some of the amputations you get, and you're like, oh my God, I can't even believe that this has been attached to a person
Yeah.
for as long as it has, you know. But yeah, they do save a lot of legs forever, you know.
Did see a lot of
nuts.
gnarly peripheral edema and vascular disease and ulcers walking around New York these days.
Oh, yeah.
Yeah.
In the homeless population.
Yes. And then
So what's happening in Manhattan? The homeless population's getting out of control again?
it's
Well,
I
I'd say
think it's spreading too.
When I was
It's
there in
like-
July for the first time,
and everyone goes, oh, this is just the spread of the Occupy Wall Street people. They used to be down Occupy Wall Street, now they're just sort of spreading across the island.
for the first time I saw, I think it was like on 35th Street, walking from the area you guys are having your apartment to
Yards.
Midtown.
Yeah.
I saw people just walking by shooting up heroin,
Yeah.
and I'd never really seen that. But right out,
Well, that stuff
block
used to
away
be
from the police station.
Yeah, that stuff used to go on all the time in the 70s, all the time. And you got to remember, the 70s, the decay of New York happened in like 15 years. It was, Woody Allen's New York, and then it was.
But then
the
at
Deuce.
Hudson Yards and to Midtown, it's more gentrified, and there are people there you know, in this, I lived in New York, but in the 70s, it seemed like it was more compartmentalized. You'd go to certain areas where here I was seeing it where I didn't expect it. So I don't know.
Something's going on. Something is going on. All right, Nicole, what else are you working on these days?
Hanging out with you.
Yes, we're hanging on. We're trying to, anybody that would like information, where should we send them? Michelle Poe? Should we, or go to doctor.com and send us a contact email, because we are working hard on giving Nicole another platform.
But I'd like Michelle's, one of the things, I think there
Michelle
are less.
and Nicole.
You guys
See?
got me started doing that.
Yeah.
But
I don't
Nicole.
even know who. I'm like trying to answer to Michelle now because I don't know if you're just going to start
I'm
calling
going to call
me.
you Nicole from now on. But I think
Dr. Bebo at Jefferson called me. She was my cytopathology boss when I worked there. She called me Michelle my entire career there. It was so funny.
Interesting. I'm going to have you once again just review your how you got into the work you're doing right now. But I'm going to let Bruce finish what he was saying.
No, I was just saying, I think there are fewer voyeurs. I know a lot of people learn from your Instagram site, and I think it stimulates some people to go into medicine or go further in it.
Yeah.
A lot of people I walk in the ER, and I've had more people go, "Oh my God, you know Nicole Angemi. Oh my God!" And it's so people in the medical field.
Oh, they dig it.
They like
we
it.
walked around town with her here. People would stop in the street and talk to her. They know her.
I hope you're monetizing it adequately.
So talked about how it happened, how you got into this field. She started in cytopath.
Right.
After she got her shit together, right?
Yeah, so I started college to do nursing because a couple of my cousins are nurses. And then my first day of biology class, because I dropped out of high school, so I never took biology like ever in high school.
She was a teen mom.
So yeah, I'm totally teen mom. I dropped out of high school when I was 16. So I started college and I took biology and I was like, oh my God, I love this. I was looking under the microscope. So I go to my teacher and I'm like, is there a job I could get looking under the microscope all day? It was like my first day of class. And she so happened to be a medical microbiologist, like working in the hospital. And she was such a dork, you know? So she was like, oh my God, yes, you could do this and you could do that and you could do this. So she like was my buddy, you know, from the very start. So she told me all about, you know, being a lab tech and being a microbiologist and cytotech and a histotech. She told me all about all these jobs I could get. And I kind of thought that cytotech was like what really appealed to me. And that's basically a cytotechnologist is looking at pap smears and stuff under the microscope. So you kind of sit in a cubicle all day and you just like look at slides under the microscope all day and you get to diagnose diseases. It's pretty cool. And you work like side by side with the pathologist too. So I did that for my undergraduate degree. And I worked at Jefferson in the city for a couple years. And then like I tell everybody this story, one day I was just like sitting at my cubicle and everybody was like making a lot of noise. And there was this really bad smell in the hallway. So I go out into the hallway and it smelled like rotted meat and disgusting. So I go out.
I need to be a part of that.
Whoa.
I know.
Disgusting.
Exactly.
I'm
but
in.
You know how I am. I'm like, oh, what's going on out here? You know, and everybody's like, oh, the leg refrigerator's broke. It's leaking everywhere. And I'm like, what are you talking about? A leg refrigerator? Because I had no idea what was like happening over there. And like, I look and it looks like a refrigerator that you see in a pizza shop, like with the glass doors and the shelves and everything. But instead of being like sodas and stuff like that, there's just legs like in red bags, but the red bags are like shaped like a leg.
Piled up.
Yeah, piled up. And it smelled like really gross, but I didn't really care about the smell because I just couldn't believe. I was just kind of like, why are there legs here? My mind was just blown. You know what I mean? I'm like, why would there be legs here? And it was so cool. And then I go back to the lab and then I saw like a bunch of residents that had been working in cytology with me and they were cutting at the cutting boards and like there was a giant ovary back there. And then one girl was doing an appendix. That's what I was talking about last night in one of my posts. And so that girl like was showing me like what she did with the appendix. And I was like, oh my God, this is so cool. Like, what is this world back here? Like, what's happening, you know? So then I would go back every day for like a couple months. And then finally I went to the director of pathology and I was like, listen, I just kind of want to work over here. I don't want to look at slides anymore. And they all tried to talk me out of it. And I said, I think there's this program called Pathologist Assist, and it seems like I could go to school at Drexel here and And they were like, no, you don't want to do this. Like, this is a really horrible job. You have to open up colons full of shit all the time. It's bloody. The placentas of this. Autopsies is disgusting. You have this like cush job where you sit there and look at microscope slides all day, and it's like nice and clean, and you're wearing a dress, and like you're not dirty. And I was like, no, dude, I want to be over here. I think I want to be over here. I think I can handle it. And like that's how I got into it. It was and like the rest is history.
Well, so you had to go back to grad school and get a
yeah. So I just went back and forth to school. Like I would take a class, and I went back to worked a couple hours, went back and forth. And I had some like really good PAs and mentors along the way that just like helped me out. And it was really awesome.
Other pathology assistants.
Yeah.
So it's like we have PAs in medicine. There's this like the pathologist PA, right?
Yeah. We have to have our own program. Like we have kind of like the same degree. We both have master's degrees, and we both get paid around the same and stuff like that. But like we have to have our own training because we don't treat live people. We don't need to learn about medications and like how to keep people alive, because we need to have like a training that's strong based in anatomy and just knowing gross findings and knowing why people die and things like that. It's just totally different than trying to keep people alive. So we have a totally different program than they have. You know what I mean?
It's sort of surgeon-esque in certain ways.
If you know pathology, you know medicine.
Yeah.
So
I feel like, I mean, honestly, I think that my personal opinion is that I think physician's assistants should be like, I think we should be physician assistants. And I think the thing should have been set up the same way that we did, almost like a residency and whatever we wanted to do.
Well, it kind of happens now out in the clinical world, because if people like want to be a cardiologist, physician assistant, they're going to spend some time with a cardiologist before they're really doing anything.
It is for every single thing except pathology. So it sucks because like some of my friends that went to pathology assistant school, they hate it, and now they're stuck. They can't go work in cardiology. They'd have to go to physician assistant school all over again. It just sucks. You know what I mean? And I think for me, it would be awesome because, you know, like I just would like to know what happens. I've never seen a surgery. I'd like to know more about cardio. I just would like to have the full picture a little bit more. So
are you advocating
I would like to have those rotations?
More training, more clinical training. I'm looking at your appendix, which is a pretty nasty looking appendix, right? The one that you put up?
It's all right.
It's pretty swollen.
It's inflamed, but it's not.
It's not ruptured or anything.
I was like, it's not ruptured. It's not that bad.
Is that a paniculitis attached to it, or is that just the color?
No, that's just the mesoappendix. Okay. It's just like the blood supply to the appendix.
Here's a question from somebody on our Facebook, and again, what is the number here on Facebook? 323.
No, we're not taking.
Oh, we're not taking calls. Okay. What was your hardest case to recover from emotionally, Nicole? This is from Shannon.
I don't know. It's kind of hard because I don't really.
Do the kid ones bother you?
Baby cases.
Yeah, the kid stuff that most people have trouble with, reasonably.
I don't really do that. Like, I don't connect with my cases like that.
So they're just anatomy to you more.
Yeah, I just don't let my mind go there.
Is it more like when you go to the Mutter Museum and see specimens there?
Yeah, it's just like that. You know when you exactly like you went to we went to the museum together, like what, last year?
Yeah, fascinating.
And it's just like that. It's just like you see like horrible shit, but like it doesn't. You have no idea who it is. Yeah. So you're just kind of. I mean, there's been times like I even said in the interview I just did for All Heart Scrubs that like one time I was doing I did a colon cancer case on like a 19-year-old a couple years ago, which it came down as a frozen because she had a colon stricture. And she went to came to the ER, had a colon stricture at 19 years old. You would never think she had stage 3 colon cancer. And then like me and my friend Annette went down to the coffee shop, and the next thing you know, like we hear her mom and her grandmom are like, oh my God, like talking about how her 19-year-old was just diagnosed with cancer. And I was just like, yo, I don't want to see a face. I don't want the connection. Like
that's the part we have to have. We have to have that part.
That's a little too close to home for me. Like,
how about somebody else was asking for a standout post, like posts that you put up that sort of stay with you. You put so many up. I'm sure it's hard to.
I don't like any of the ones that. Actually, like it's funny because in practice I didn't have any really close cases to me, but now just doing the Instagram, I have cases because I'm actually talking to mothers that lose their children and stuff. Like, I mean, obviously, like that's the worst ones to me because I'm a mom and I have little kids and I also have a bigger kid. So anytime a parent loses their child is like the worst thing in the world to me to recover from, I think.
Patty wants to know if you talk to them.
Yeah, I talk to anybody that emails me. I have
No.
like
No,
Talk
they-
to your specimens.
No, the 19-year-old's family.
No,
no. That's not appropriate.
No, she means you talk to them while you're working on their bodies.
Right.
What?
No.
What? We
Do
are
you talk to
macabre.
yourself? Do you have voices in your head?
Well, that's another.
That's a whole other matter with Nicole. A whole other matter. I'm looking.
Stay
I'm
tuned to my show.
getting.
Was that a theatrical pause, or were you listening to the voice?
I'm just getting it's so when you really start scrolling down through your Instagram, it gets overwhelming, even for me. It's really kind of wild. And I didn't notice. Do you block these posts that have the little eyeball with the?
No, that's something Instagram does.
Huh.
I don't know how they. I think that it's probably based on some kind of a computer system that people report it, and then it blocks it somehow.
So you see this? It has this eye with a
Oh,
cross
yeah.
through it.
Oh.
You
We're
have to,
trying to.
you have to click on it again to see the photo.
Right. Well, at least you could do that now.
Yeah, I
For a
know.
while you couldn't. Well, there are not enough autopsies
Even
being done.
with the cool
right?
stuff, I'm like,
Do
I
I want to click on it?
And it's been a lot of hands in there lately.
Is there
Literally.
Is there still
Messed up hands.
a lack of? I mean, autopsies are not as common as they used to be, and it was.
Yeah, autopsies are definitely down. I think that the pathology residents have to do 50 autopsies in their 4 years of service, which is a lot, you know.
But
They
what was
each
the
have to do
peak, like in
50.
the mid 1900s, or the peak 20th century? They were
Oh
they were
my
done
God,
almost
I wish
all.
I was alive then.
But it's sort of, we're missing out on a lot of learning.
We're missing out on so much. It's ridiculous.
Yeah.
Autopsy is the center of medicine. I don't care what anybody says.
Well, it sure historically has been. And what's your husband doing riding a bicycle around the Costco or whatever, wherever he is there?
We were in Toys R Us.
I
And
thought
my
that went
kid
out of
was
business.
crying, and he's riding around on the Peppa Pig bicycle.
Okay, here's a question I missed earlier. Where do they put the leftover body parts they amputate, and what do they do with them?
Okay.
Okay, so that's a good question.
Yeah.
So when we get specimens in surgical pathology, we keep them for a month after they are signed out by the pathologist, which means that's when the pathologist puts the report out that goes to the doctor. And after that month, they get incinerated with the trash, like the medical waste. So they get like burned basically. So we, have kind of big shelves that usually most it just depends on what hospital you work at, but they're either kept in the morgue or we have a special closet that we keep these big shelves and we label
Or a
week one, week two,
a
three,
leg
four.
refrigerator, a foot refrigerator.
Yeah, and then
lost
we have the
in there.
refrigerator with the legs, and then the refrigerator for the legs usually keeps like big specimens like panis and like things that we can't put in formalin.
Let's
And,
explain to everybody what panis is. You know what that
Panis
is?
my dream
know what that
surgery. It's like the giant flap of skin you want to get removed after you have like a million babies, or if you have like extreme weight loss surgery.
Sometimes,
It's like a tummy
yeah.
tuck surgery.
It's a huge.
have
It's
one.
a
I have
big.
one.
Yeah.
I
Panis.
can't wait to get that surgery. I'm like dreaming
So
about it.
I had
For
that.
yourself?
Be like one
I
of the
had that
episodes of my show,
surgery.
too.
I didn't know they kept it for a month.
Oh yeah, they kept your panis. Don't worry. But let me ask this: we early on we're talking about genomic medicine, and one of the reasons you keep the path specimens of the tumors around is to be able to test them later.
Well,
And-
that's different. So I'm talking about the actual specimens themselves. Like we're talking about like ovary in a jar we
Right.
keep for 1 month.
But
Now the paraffin blocks, the actual blocks.
well, that's what I want to
for-
ask. Do you need actual gross specimen to do some of this
No.
newer genomic testing?
You just need the blocks.
That will give you a genome. To give you gene testing.
Yeah.
Huh?
So the blocks.
Because it's not a dye or anything. It's not a dye testing, right? It's an actual DNA test. No.
No. Yeah, but usually we send out the blocks just
Okay.
to those companies.
And
they
those
do
go?
whatever they do
And
on
you keep
them.
those essentially for nearly forever. Yeah. Right.
Yeah. Yeah. The blocks we have, oh my God, every hospital just has, and then we like send them out to storage because there's just so many of them. But in in the hospital, we have like years and years and years behind, and we keep the slides forever too. It's just, and the paperwork and everything like that. But the actual specimens are so bulky, so we just get rid of them within a month. And then autopsy specimens, we keep like little portions of, so like when we do an autopsy, we can't keep all of the organs from a person because that would take up like 5 jars. You know what I mean? Because it's like a lot of organs.
Wouldn't it be like
So
an
what-
Egyptian burial site?
Yeah, exactly. So
the
we
Coptic,
keep,
whatever they
we
call
actually keep like,
No,
what we
the
call
jars.
stock
They'd have all the
jars,
jars of stuff. Yeah. What will those
yeah,
have
we do
names?
though. Like we
Yeah.
keep one for the brain, and then we keep one for like what we do, like either one big one for sample organs or one for the right side of the body and one for the left side of the body. And we just keep like a little chunk of right lung, a little chunk of left lung, like just chunks of tissue in case we have to go back to it. And we keep those for about 3 months until after the autopsy is signed out. But we can't just like store all, it's just so much to store. You know what I mean? So
Yeah.
we have to like be throwing those out and rotating through that.
And let's
like,
go back
every-
to what you said about autopsy being the heart of medicine. To defend that position, what do you mean by that?
because you
Canoptic jars.
you just learn everything from whatever surgery you're doing or anything like that. You learn from the autopsy. So you messed up something in surgery, you do the autopsy. Somebody died and you think they died from something else, you learn it from the autopsy. Like the imaging is just not, it's just not the same as doing the autopsy and holding the things in your hands and looking at it in your hands. It's just not the same. And
under the microscope too. You're seeing stuff on the microscope you can't see any other way.
Exactly. And there's just been so many times where they're like, oh yeah, this is what this lady died from. And then the family pushes for the autopsy and then we find something else. And it might not even be something else that's super crazy, but it's just like, I don't understand why. I do understand why people are against it, because then it holds you liable if you find something else. And then
I'm not sure it's liability. I'm not sure that's the issue so much as just the delay and people's grief and stuff. And they just don't want to deal with it when they're there wrapping things up with the family. They just don't want to bring that up. It's uncomfortable to do that. But I was thinking about I bet every ICU, every person that dies in an ICU, I bet you could find 5 things you didn't know about.
They said a lesion for each 10 years over 50 years old. I remember the pathology used to tell us that. But
What?
that everybody, once you hit 50, every 10 years you get another major lesion in your body. Remember?
And then you could find it at autopsy.
You could find it.
Well, but how about in ICU? I mean, people die of kidney, they have kidney failure and they have ARDS. What's really going on in their kidney and lungs is just a guess, right?
Absolutely.
Yeah. So, and you could really find out what happened.
Now, do you get all the forensic cases? So if it's a coroner's case, where do those go?
We would get, like, if you work like in a trauma center and you get all those people, especially when I was working in Jefferson and Philly, like people get shot, people, whatever, and they go to the trauma center, you know what I mean? But they go
to the coroner.
They go right into the refrigerator, and then the Philadelphia medical examiner picks them up.
You ever go and watch those?
Yeah, I had to for my training. I was there for a couple months.
Now, how about overdose deaths? Are you seeing more?
They all go to the medical examiner's office.
Here's a question from Lisa from MLS. What is that? Would that be high school, middle school? MLS. To your position, how much schooling is required? MLS. What would that stand for?
Medical lab scientist, probably.
Maybe.
He's probably a person that works in the laboratory doing testing on blood.
Okay. So from MLS to your position, how much school is required? Lisa.
An additional 4 years.
A graduate.
She would have to get a bachelor's degree.
And then 2
if
years.
She doesn't have a bachelor's degree already, and then she has to get a master's degree.
What is your goal for the future? This is from Janet regarding traveling and speaking. Is there a platform in colleges where you could speak? And I agree with that. You should be speaking in colleges. But go ahead. What do you want to do? Besides, we're going to create a TV show. What else? We're going to do that. Ask Michelle.
I'm going to be working with Dr. Drew on this TV show that he is
hell bent on creating. But think about other stuff you want to do. Any speaking or anything? What other stuff?
Yeah, I just want to do everything in conjunction with everything. So I want to do the Instagram in conjunction with the TV show, in conjunction with speaking, in conjunction with
the goal being raise awareness about how the human body works in a way that
I want everything to work together. And
but it's, I feel like I've always felt like your thing was like medical literacy or biological literacy, right? Would that summarize it?
Yeah, I just want it to be on the level where everybody could understand. It just doesn't
Yeah.
it doesn't have to be like craziness. It's just
No, but I
Were
really
you
I want to
talking?
focus in on this because you've always been sort of upset that one of the things that motivated you was that the average person doesn't see what we all see as medical people, and there's just no reason why the average person shouldn't have some exposure and some understanding to that. In fact, the fact that we keep it from them is a sort of a tragedy.
yeah, totally. I mean, and I'm gonna keep pushing it in their face.
Okay, good. All right. Is Michelle, you trying to ask something, or is that?
But I did look up the hyoid bone.
Yes, and where did it come from?
Well, no, the only evolutionary significance that I could find is that about 300,000 years ago,
Yeah.
it dropped so
Yeah.
that we could make complex speech, and it's basically what separates us from the chimpanzees. The
And
sound.
what was it doing before?
I don't know. It just wasn't
it was
doing.
part
It
of the
doesn't.
it was-
It wasn't doing much of anything
was
until
part of
it
the
came
jaw.
down and gave us the ability to make
I think it was part of the jaw.
complex speech
Interesting.
sounds.
Interesting.
Only humans and Neanderthals and other animals have different versions of it,
There
but
you
they
go.
all work with the larynx
Thank
to
you.
help us
They-
speak.
the
Fascinating.
muscles.
I don't
yeah.
know if that really answered the question.
No, that is getting there. It's getting there. Nicole, as always, it is a privilege and just a joy to talk to you. And people should get you at Mrs._Angemi. Thank you for making Bruce and I feel dumb, as you do often. Which
No, you guys did really good tonight.
we're getting better. We're getting better at it.
Yeah,
So
I'm excited.
yeah, we're learning. See, she's a teacher.
know.
You're a teacher, and you're
Yeah.
teaching us.
Giving me PTSD from pathology class.
Did you have a pathology class?
Yeah,
You had to.
of course, yeah.
No, I did
And
not.
lab, pathology lab, unknowns and gross anatomy and
we had
pathology.
gross anatomy.
Where did you go to med school?
Me or Bruce?
Both of you.
I went to SC.
I went to Loma Linda, which when I did my elective back at NYU, the guy goes, "Where in Mexico is that?" Things have progressed. Their mistake wouldn't be, oh boy, I'm in trouble with that.
And don't forget our friends at Alliant.edu. Alliant, of course, were the professional school therapy and the California School of Professional Psychology.
They have
Great guys there.
forensics there, too.
They have forensic psychology there too. Yeah, but a little different than the forensic pathology, but they have forensic psychologists, which is a very interesting field in itself. But I had my pathology was all under the microscope, I would say, and in textbooks. I didn't actually see much pathology. I did do when I was like pre-med, I did an autopsy thing that stayed with me forever. But I don't remember really doing much path after that, really. Yeah, not, except just in books and things.
We had a great.
You guys both had cadaver labs, right?
Oh yeah.
Oh.
No, gross anatomy is top to bottom.
Yeah.
That was all year long.
And there's a great pathology museum out at Loma Linda.
Is that true?
Yeah,
I did not know
that's
that.
right.
Yeah, I heard
It's
that
one of the
too.
best. One of the best around.
Isn't that where we were going to use
That's where you're going to do the show. Remember?
That's where we're gonna do the other one.
Oh yeah.
Yeah, but we'll bring Nicole
We'll
here
talk
for this
about
one
that.
too.
Yeah.
All right, you guys. Nicole, again, thank you. Any place else you'd like people to go besides your Instagram site?
I have a charity page up right now. The link is in my bio it's for Children's Hospital of Philadelphia. I'm trying to raise some money for the holidays for kids with cancer. It's actually for their families. So
Great.
they have some money for the holiday time to, because the kids are staying in the hospital and stuff. So
I hear you.
it's just a
Great.
small goal. So hopefully,
And what's that website again?
the link's in my bio on my Instagram page.
Great. Find it there. Nicole, I will see you soon. Bruce,
Always
thank
fun.
you. Thank you, everybody, and we'll see you next
All
time.
right, cool.
Bye.
See ya.
Well, one of the great parts about working in recovery is seeing former patients successfully move on. And I've had patients that have come up to me years later and shake my hand and say, you know what, sometimes people are kicked out of treatment. And many of these folks move on to become mental health professionals themselves. And of course, the field of psychology is vast. The need for competent practitioners is huge. If you're considering this rewarding career, I urge you to consider the California School of Professional Psychology at Alliant University. Now, I've known them for a long time at Alliant University. I've spoken at their past events. It was founded in 1969. It's boasts an alumni network of nearly 50,000 people worldwide. And Alliant has fostered many of today's mental health pioneers, authors, and advocates. CSPP at Alliant University hosts both on-ground and online programs in business psychology, marriage and family therapy, clinical counseling. They also offer APA-accredited doctoral programs in clinical psychology that can allow for specialization in child psychology, clinical forensic psychology, and integrated psychology. And the faculty is crazy. It's made up of of leaders and historical figures like Abraham Maslow, Carl Rogers, Viktor Frankl, some of the true fathers of modern psychology. For more information, and I worked alongside of these students as well, by the way, in the clinical setting, as well as having lectured at the institution. So for more on the California School of Professional Psychology, CSPP, at Alliant, click the Alliant banner on our website or visit Alliant, ALLIANT.edu, alliant.edu.
Remember, you can find all these podcasts at drdrew.com. The Dr. Drew podcast, the This Life podcast, and the Adam and Drew podcast, which is available 5 days a week. Find them all on iTunes and rate us 5 stars. Subscribe and get it first. And if you're really happy, click on the Amazon banner at drdrew.com to help support the show. We'll thank you for it. If you join the email list via drdrew.com/contact, we'll send you a weekly Infusion newsletter with Dr. Drew's news. We're so grateful when you get in touch. We read all your emails and we'll bring you the subject matter you want to hear about.
You live.